Hello and a warm welcome to MedX, the latest from the world of medicine. The FDA recently approved Darolutamide in combination with docetaxel for the treatment of metastatic hormone-sensitive prostate cancer. The approval is based on results from the randomized Phase 3, multicenter, double-blind, and placebo-controlled ARASENS trial. Patients treated with darolutamide plus docetaxel and androgen deprivation therapy had a statistically significant increase in OS, with a 32% reduction in the risk for death compared to those given only androgen deprivation therapy and docetaxel. Treatment with darolutamide plus androgen deprivation therapy and docetaxel also resulted in a statistically significant time to pain progression delay. The drug Capmatinib received regular FDA approval for metastatic non-small cell lung cancer patients with the MET exon 14 skipping mutation. The FDA had previously granted fast-track approval to the drug, subject to promising results from the Geometry Mono 1 trial. In the open-label, multicenter, non-randomized, Phase 2 study, investigators demonstrated efficacy of the drug in a cohort of 160 patients. Among previously untreated patients, the overall response rate was 68% with a 16.6 months duration of response. Among the other group receiving Capmatinib as a second or later line therapy, the overall response rate was 44% with a 9.7 months duration of response. A retrospective cohort study of women giving birth in a large U.S. healthcare system between March 2020 and January 2022 identified the risk of severe maternal morbidity events associated with SARS-CoV-2 infection. Patients with SARS-CoV-2 infections had significantly higher rates of severe maternal morbidity, or SMM, events than those without in all time periods, except during Omicron. This cohort study also found that the SARS-CoV-2 Delta variant was associated with higher rates of SMM events compared to other strains. Given the potential of new strains emerging, these findings emphasize the importance of preventive measures. The GSP 301 nasal spray, which includes a fixed-dose combination of antihistamine, olopatadine hydrochloride, and corticosteroid mumtasone furoate, was recently approved by the FDA for children at least 12 years of age. According to a study published in Annals of Allergy, Asthma, and Immunology, GSP 301 nasal sprays are effectively treating symptoms of seasonal allergic rhinitis in children aged 6 to 11 years. It was reported that children in the GSP 301 treatment group showed significant improvements in nasal symptoms, total nasal symptom scores, and scores of tearing/watering eyes compared to the placebo group. A recent study published in the European Heart Journal Quality of Care and Clinical Outcomes demonstrated that rates of cardiovascular admissions are increasing among cancer patients. According to this study, patients with prostate cancer reported the highest prevalence of hypertension and peripheral artery disease, while patients with hematological malignancies had the greatest burden of valvular heart disease, chronic renal failure, anemia, and coagulopathies. During the study period, admissions related to cardiovascular events in cancer patients increased from 13.6 to 16.6 due to heart failure and 6.4 to 8.8 due to pulmonary embolism per 100,000 people. Data from the study also reported that cardiovascular admission rates rose by 23.2% in patients with cancer but dropped by 10.9% in patients without cancer during the study period. These were the latest highlights from around the world of medicine. Tune in for more such fresh updates.